Okay, hello everyone. This is my group grief counseling video submission. I do have everything on my laptop, so I'm going to be glancing over and reading my information out to you guys. So the first one is individual therapy. I defined individual therapy as helping the victim come to terms with the death of a loved one and learn to live in a world without them. Is the main objective of grief therapy. The 4 stages of grief have specific objectives that align with them. Number 1 is making the loss more real. Number 2 is supporting the patient in addressing the behavioral and emotional pain. Number 3 is assisting the counselor in overcoming the obstacles to readjustment, internal, external, and spiritual. And the last one is assisting the counselee in reinvesting in life and remembering the deceased. For risk for individual therapy, according to our textbook, there's an 8 variable risk index to identify family members in special needs of support. If several of these dimensions are present in the 4-week post-death assessment, the person identified as in need of intervention. The dimensions are: number 1, more young children at home; number 2, lower social class; 3, employment, little if any; number 4 is high level of anger; number 5 is pinning high; number 6 is self-reporting high; number 7 is lacking current relationships; and number 8 is coping assessments rather than requiring help. Benefits from individual therapy is a common reason why people visit us is to get pain relief in the right way. They are looking for medication that would lessen their discomfort. A significant component of our service is assisting people in accepting and overcoming their pain. Survivors often struggle with emotions such as powerlessness, loneliness, rage, remorse, and worry. Acknowledging that an individual has passed away and will not be coming back is the first step in the grieving process. Both survivors can address the emotional effects of the loss. They must come to terms with this truth. How can you assist someone in realizing their loss? Encouraging survivors to talk about their lost ones is one of the finest strategies. This ought to be supported by the counselor. Why to do individual therapy? Cognitive reconstructing could be required because our ideas, especially the contextual self-talk and hidden thoughts that consume our brains, have an impact on our moods. The counselor can assist the client in reducing the dysmorphic symptoms brought on by certain illogical beliefs by assisting them in identifying those thoughts in reality, testing them for connections, corrections, or oversimplification. A strong theoretical knowledge of a human behavior and personality should form the foundation of any counseling or treatment rather than just a collection of methods. For group therapy, support groups are often formed from social, educational, or emotional reasons. Groups can start out with one goal and end up with another, even while emotional assistance is still provided. Groups that start out as support groups for one or other many reasons may remain with the same members for a while and evolve into a more social gathering places. While there is value in each of these goals, I strongly endorse organizations that are designed to provide emotional support. Certain groups are closed-ended, which means that the members join and depart at the same time and that they only last for a set amount of time. Some groups have no clear conclusion and are open-ended. Individuals arrive and depart based on how the group meets their needs. All group structure types have advantages and disadvantages. Since new members are unaware of the history of significant acts and discoveries made before their arrival, it may be more challenging to bring them up to speed in open-ended groups. For risk in group therapy is that people arrive at group therapy with a variety of expectations, and if these expectations are not met, they may get disillusioned and decide not to return. When someone disappears, it's not only regrettable for them personally, but also disheartening for the group. The intake person conducting the group selection interviews can help to mold people's expectation and address any false anxieties or misconceptions about joining the group prior to the first meeting. Everyone is welcome to share as much as they would want in the group. Therefore, someone who doesn't share would obviously not fit in, that would be another risk. Benefits are a sense of responsibilities due to ground rules, such as members are expected to attend each of the sessions and to be on time. Number 2 is information shared in the group stays in the group. When outside, the group members are not free to talk about another group member's experience. Number 3, people are free to share as much or little about their losses as they choose. Number 4, everyone gets equal time to share their experiences, his or her experiences. This rule helps avoid problems of one of the person monopolizing the group's attention. As counselors, we do not give advice unless it is asked for. It's very easy in group situations, particularly in group therapy, for people to give advice. Generally, the advice is not solicited and it is not accepted. So why do group therapy? People need to feel like they belong in a group, that they can influence other group members to some extent just as much as they feel the need to fit in. If they don't, it's unlikely that they'll finish the group therapy session with a feeling of control, affection, and inclusion. When grief counseling is expected, the person is still in a state of numbness or shock and is not ready to come to grips with his or her confusion. In some situations where there is awareness in an impending death, the counselor can make contact with the family members in advance of the death, reconnect with them briefly at the time of the loss, and offer more extended contact a week or so after the funeral services. Again, there is no set rule, and this time schedule should not be taken as hard and fast. Should not be taken as a hard and fast rule. This really depends on the circumstance of the death and the role and the setting of the grief counseling. Roles of the support groups. Because they offer structure, members may feel secure. It might straighten a person's sense of support to know that there are guidelines for conduct and posture. In addition, ground rules aid in control for leaders. To make sharing more authentic, the group leader can refer to the ground rules if and for instance, everyone has an equal amount of time to discuss about their own experience and one person is using up too much time of it. The group leader can also openly address any instances in which a member has violated the confidential agreement prior to the first group session. It is always a good idea to go over ground rules and remind everyone of them. So for some suggestions for clinicians, the following recommendations for healthcare professionals might increase the effectiveness of their interventions. Number 1 would be to reject the notion that everyone in the mourning process needs grief therapy. Keep in mind that not every mourner is a good fit for this same kind of grief therapy. Each experience of grief is different. Using the 7 categories of mediators who mediate the mourning process as a guide, tailor your treatments to each mourner's perceived requirements. Use a cohesive theory like the chores of grieving as a foundation for any intervention in grief therapy. Perform a thorough intake prior to the intervention, whether receiving family, group, or individual therapy. This may be done for grief counseling. Adopt a customer-focused mindset. Get informed from the clients about their needs and desires and evaluate. Use a screening tool if one is available. And if one is not available, identify your high-risk groups in your population and focus your intervention on them if the screening tool is not available. Thank you.